Okay, well, we've all decided we're going to stand up and use calories. Great. Okay. So the first question I'm thinking is, how do you, either of you or both of you, could you tell us a little bit about what you think about how we could tailor your programs to really better address disparities? And I know you're both doing it because you're in areas where there are disparities, but are there any ideas you have how others can better address disparities through tailoring of worksite wellness programs?
Well, I think one of the issues is how things like this are organized. So if, in our experience, if you have what we call a peanut butter program, you smear it the same over everything.
Yeah.
Some people are going to pick it up, some people are not going to pick it up, some people will like it, some people will don't. About several years ago, we adopted, as part of our partnership with labor, something we call unit-based teams. So all through our system, we have workers working in very small groups on problems that they select that are aligned with the priorities of the organization. It could be a quality issue, it could be a process improvement, it could be a workplace safety issue. But we have very small groups of people who work closely with each other, take those problems on, and we support them to try to find solutions to them. So as you build that kind of engagement in the workforce where people in small groups are organizing around things, you get people picking up things and tailoring them in their own way that might not even have been intended. So as I was watching Sharon's photos of small groups of people walking together or sort of showing off to each other or whatever, that's the way these programs can get. And so it doesn't directly address the equity issue, but it does address an issue of making it widely available and then accepting that people pick it up in somewhat different ways and use it in different ways. And I think, at least in our setting, that's something that has made it powerful. So KP Walk, which is open to everybody,
Yeah.
but the three of us could sign up as a team.
Exactly.
Because we work together, and we'll compete against somebody else's team or somebody else's team. If it's just me on my own, I might look at them and say, are you kidding me? I'm going to sign up and log miles across America or something like that. But a team, pretty soon, will be competing with some other people. It gets picked up in a different way, and there's just a very different dynamic to it. But I think the advantage in the workplace is that, in a sense, you do have people operating on a similar footing, in the sense they do the same work for the same company. And so there's an opportunity to get past some of the kind of obstacles to access that happen other places. That said, it is going to be a challenge to any workplace around some of these things. And activity, I think, is a particular challenge, because in order for people to be active, they have to have permission to be active. You have to be real about breaks. You have to understand that if people have only got a short lunch period, if you want them to go out and walk, they are going to eat. Do you have fresh fruits and vegetables available, easily available? Is the amount of time for a break really enough? These are real touchy issues that become big issues of themselves, and employers are really going to have to open up around some of that, or there will be inequities, and the inequities will be the people who have the most rigid schedules, the least flexibility to make decisions for themselves, won't have the same opportunities.
No, that's helpful. Really talking about the most basic level of community in the traditional sense, the grassroots community making decisions. That's really helpful. Sharon, what do you think about any tailoring you can think of to bring in the...
I think Dr. Baxter hit the nail on the head in terms of being able to not reinvent the wheel. That's really what's worked for everybody in our WIC community. Not all WIC programs run exactly the same. We have some really small agencies, and then we're a really big agency, so we don't do things the same. And he's mentioning all the challenges we have. Our business is to serve participants, so how can we do that and at the same time support our staff in adopting healthier behaviors? And some of them do the instant recess, for example, in different ways. Some of our staff likes to do instant recess kinds of things just with staff, and then some agencies actually do it with participants. And so they have cooperation with that, and they get permission from the participants, so they know that we see them, we want to serve you, but with your permission, we're going to take this short amount of time and all be active together. And it works. So I think it's kind of like that's how we can take back and address some of these communities maybe that don't get addressed with promoting this information.
Very nice. And as Sharon mentioned, I mean, we go all the way here from an organization that's really has a lot of commitment to wellness of its staff and has the financial resources all the way to kind of almost a grassroots effort at WIC, and then a lot of businesses in between that pay for a program to bring worksite wellness program into their business. So we have the gamut here. So my next question was on incentives. Do you use any particular incentives, or do you think that incentives will bring in that hard-to-reach population and it can be used? I know sometimes they have graded scales where you start low and then you keep incentivizing. Do you have experience with?
So as a fundamental belief, we are not particularly convinced that financial incentives and penalties work other than for a short term with some people. And if you really want to get a significant, broad change, that you need to have a collective approach to that. So the approach that we are taking is that we have an incentive pay system in which the savings that are accrued go back into the workforce as a bonus at the end of the period of time if we achieve our goals collectively. But we have not adopted a goal that says your premiums will be reduced if you stop smoking, or you'll pay more for your coverage if you don't lose weight or something like that, because we're not persuaded that those really have an enduring kind of effect. So that's one thing. I mean, and part of it's based in the science. These are communicable diseases. It's always astounded me we call them non-communicable diseases. The behavior is communicable and it's social, and we want to harness the good side of that and take advantage of it. The second thing is that we want everybody to take a health risk assessment so that they really kind of have profiled for themselves and gotten some feedback on what's going on in their behaviors and their health and their risks. Again, we took a different approach. Most organizations, a lot of organizations give people a gift card or something like that for $25 or $50 or something like that to take a health risk assessment. What we did was, for everybody who took it, we put money into a pool to be used for charitable purposes. The money that accrued then from everybody taking the total health assessment, the risk assessment, we then used to grant out to Wholesome Wave, an organization that some of you may know, in order to support people who have SNAP benefits, being able to use them and get double value for them at farmers markets. So you try to find solutions that get 1, 2, or 3 benefits out of the same act. And we were astounded. People were, thought that was a great incentive to have. So that's a different kind of approach, but it stems from valuing the workforce and your colleagues rather than believing that you have to pay people to get them to do something.
Oh, very creative idea. Sharon?
I really like what Dr. Baxter is saying. I wish I could work for Kaiser in the sense of having access to some of these things.
I wish we could harness your enthusiasm.
We have to do things a lot different in our setting in terms of incentives, and I find that even like you should have seen their faces when they got those bags this year in March. We had all the staff in for a training, and each of them got a bag as they came in. And then we kind of are building on that theme all this year about what are you putting in the bag. And so they're carrying them everywhere. And so I think that the bags were just $1. I mean, that's not a lot of money. But how do you even come up with $1 when you can't use WIC NSA funds to spend it? So you have to be really creative. And so we have done everything. I've robbed Peter to pay Paul to come up with money to do these kinds of things. And just a little bit goes a long ways, like pedometers. And we've gotten pedometers from different people, and that is a way that staff can monitor and track their activity. And, programs like Everybody Walk. And so we've partnered with other organizations and whatnot to kind of get some of those things. I do think tangible, meaningful incentives that tie in with the theme are effective to keep people motivated and reinforce some of the messages. That's how I've seen them. The tools.
That you're using too. And that's very helpful. And my last question has to do with what research do you think, if you could wave a magic wand, would you like to see that could help move this forward into other businesses or organizations or help your own? Is there any research that you think would be helpful?
I think this whole area of incentives is an area that's ripe for application to this work, and people have done a lot of work in some areas with it, and there's a lot of work that's being done now around behavior change and how to trigger that and when that's most effective. But the sort of pulling all of this together around changing behavior with individuals, with groups, with culture, with surrounding, I think that's the next area that people are really going to be looking for guidance from research. And it'll come in a couple ways. It's an almost theological debate about punishing people versus paying people, individuals versus group, and it gets into how you're wired. And we need to break through some of that and say, get our eye on the ball here about the tremendous potential value created by a culture of wellness in the workplace and that goes outside the workplace to everywhere people are. And have some science underneath it to help us start to practice it. Because right now, most people are experimenting with things.
Okay, that's very helpful. Yeah, Sharon.
I really think we need more research in the area in our particular setting with some of the work that you started off with the Fit WIC. I do think that we need to see how this is all panning out. Because I showed you examples of just 3. We have probably 100 employees that have transformed from being really overweight and unhealthy to being much more healthier and champions for the rest of the staff. But what effect is this really having on our participants? I don't think that's been really, the study has continued, so I think that would be valuable. And can I ask one other thing? If I would also suggest that more be done also to promote other kinds of questions being asked, because I think health behavior changes take time. And I don't think things happen for most employers where you're going to see, the study, the RAND study that you kind of quoted, it looked, insignificant, as I remember in the Reuters article. I read that also. But I think that they didn't look at how much weight did people not gain. So they only asked certain questions. So I think we also have to look at maybe some of the benefits that they didn't get any unhealthier, because you have to stop gaining weight before you can start to lose weight.
We say maintain, don't gain. And I had exactly the same reaction to that when you were describing that part, of saying, wait a minute, if people didn't gain 2 to 5 pounds a year, like they have been every year before that, and that sort of thing, that's not necessarily a bad thing.
And on a population level, a pound is a little different than it is on an individual level. Yeah. So, well, good. I think this has been a wonderful, helpful panel. Would you like to have a last word on, anything you'd like to tell the audience, and then we're going to go into our next break?
I think I said what I had to say.
Okay, good. Sharon, is it?
No, I think I have also said that.
So now I'm going to thank you both. This was a fabulous panel. And don't go anywhere, because we have a special exercise tribute to Dr. Tony Yancey that's going to be led by our very own Dr. Salas. And I will give you the mic here.